I have Katie McCleary with me today. Katie is the president of Visiting Nurse Private Home Care. She's one of the most genuinely caring and compassionate people I know. Not only does she run a company that serves caregivers by providing in-home care for their loved ones, but she also runs a nonprofit to help professional caregivers furnish their homes. Katie, thank you for joining me today.
Thank you so much for having me, Brian.
Oh, it's truly a pleasure. This series is focused on providing insights and resources to those who are caring for aging and ill loved ones. What is in-home care, and what challenges might caregivers face that would let them know that in-home care could be helpful for them?
You mentioned our company is Visiting Nurse Private Home Care, and we're affiliated with Visiting Nurse Health System and Hospice Atlanta. And all of this umbrella of services comes into the home to support a family through whether it's a crisis or it's an ongoing issue. But specifically, private home care does one-on-one services to keep someone safe and independent at home.
Great. And I know you do both medical and non-medical in-home care. Can you talk a little bit about the differences there and what might let someone know which type of service they need?
Important question. Thank you. A lot of times we'll get a phone call that says, I need a nurse. And as we dig in deeper, what we realize is no, they don't need skilled care. They don't need a nurse. They need a certified nurse assistant to help with activities of daily living. That's non skilled or non medical. Medical requires a nurse and it does things like wound care or tracheotomy care. Or even IV antibiotics, medication management. So those are the two major differences.
Okay. So there are the true medical needs, and then there's the daily living need. Those are really the two different categories.
Perfectly said, yes.
Okay. And what does in-home care do for the caregiver?
I would argue there's a lot of things. I mean, you look at the caregiver from a couple of different perspectives. One, that caregiver looks like you and I a lot of times, right? They have families of their own, they have companies, they have families, spouses, and other activities they're trying to do, and aging parents that are requiring their time and
Yeah,
assistance. And so, in home care provides peace of mind and expertise. Similarly, as a spouse that's doing daily caregiving for a loved one, sometimes you just need respite because God knows it is nonstop. It's 24 hours a day, and you just need to back away because if you're not taking good care of yourself, it is impossible to care for somebody else well.
absolutely. And as much as you love the person and care about them, it really is a heavy burden to carry. So
Indeed.
having that help could be tremendously valuable.
Oh, indeed.
Yeah. Now, let's think from the perspective of the loved one or the patient. What does in-home care do for that loved one who's receiving the care?
Again, there's a long list, I believe. I mean, just down to tactical things like being able to get out of bed safely, right? But I'm going to take it up a level or two and just give you two. One is independence. We all want to stay home, right? We all want to live in our homes with our pets and our things, and private home care allows for independence. And the second thing is dignity. There are just some things that I don't need my children to do for me, or my spouse to do for me. You want a little of that mystique to stay there. And private home care brings a very courteous, kind, loving professional into your home to handle some of those things that maybe other people shouldn't be doing for you.
Hmm. Yeah, I hadn't thought of it quite like that, but having helped my mother care for her mother, there were certainly times that both she and I um, cared for her in very intimate ways, and it can be hard, that dynamic of being family, doing that for an older person in your family can be challenging, and I can imagine from her perspective too. So thank you for sharing that.
Indeed.
Dignity is an important piece, I think. Yeah.
Yes.
And your passion is so easy to see. I mean, you even told me this that you've been up and at it since 4:30 this morning. You said that with a smile on your face because you love what you do. Can you talk a little bit about your passion in this industry?
I love it. I love it every day. I've loved it for 13 years so far. And I'll tell you, while we serve all ages in all kinds of communities, my passion really lies with our seniors.
Mm,
I just love our seniors. And I love the fact that we have angels that go out and serve our seniors. And so I would say what makes our company unique is that we see our caregivers, our professional caregivers, as our clients first, and we care for them so that they can go out and care well for our clients.
mm.
And so there's a lot of love that comes from our group.
Yeah, and that's actually how you and I met. Being one who runs an estate sale company, we're often looking for charities to donate leftover items to after a sale, and you and I met because you take those items, you run a nonprofit, take those items to provide for your employees and others in the same industry who don't make a lot of money for the intense and great care that they give. And so you help to provide for them.
Indeed, yes. Sylvia's Attic certainly makes a significant difference in the lives of our caregivers so that they can focus on their care for another person.
That's beautiful. Love that that care trickles down the entire ladder within your company. That's beautiful.
Indeed.
Well, if someone would like to reach out to you and learn more about your services, what's the best way for them to do that?
Well, even carrier pigeon. But I will say our phone number is 404-658-5800. And certainly check out our website. Even when you call, check out our website. It's visiting nurse, all one word, P as in private, H as in home, C as in care.com. Visiting nurse, PHC.com.
Thank you. I'll make sure that information is below. And Katie, thank you for your time and expertise today.
Thank you sincerely, Brian. It's been
It's
a
been a
pleasure.
pleasure.